7-month-old, and Mum's telling me he hasn't been feeding, he hasn't been himself, he's just not settling.
Okay.
He is looks a little bit unhappy to me. He looks like he's a little bit distressed.
Yeah.
I think it just needs
2 minutes. I think just come in.
Paediatric consultants here.
Just have a word.
I'll
be right there. 2 seconds.
I think. So
Hi guys, sorry,
just talking
I
about.
just need to go next door. We're having a big here.
Okay. All right.
So you're going to have this little speak to his Natalie, so that's little Jimmy.
Yeah.
We've just done a quick set of obs. We'll just come back on.
Okay.
So it's Premier, 7 months, 33 weeks.
Yeah.
I think we've witnessed a couple of episodes of apnea.
Okay.
Like I say, I'm just going to be nipping next door.
Okay.
Look over.
Are you going to be coming back?
I'm literally
Okay.
going to just have a DK and a little bit of a flap.
Okay, great.
Give me a couple of minutes.
Great.
Sit back.
Have we got a set of bots there, John?
Yeah, I'm going to do it now, yeah.
Fantastic. Hi, Manny, I'm one of the anaesthetic doctors. Is this Jimmy?
It's Jimmy.
I'm just
Yeah.
Jimmy Smith. I'm just going to chat to the nurses and have a quick look at the observation.
Just 2 seconds, I'll be right with you.
One second. Okay. So, everyone's just dipped out. What's brought you in with Jimmy today?
Well, he's just not seeing himself. I don't think he's very well.
Okay.
He's not eating, he's not really drinking, so he's not
Yeah.
really much either.
And how long's that been going on for?
I've just noticed it sort of lunchtime today.
Okay.
I thought about taking him to the doctors, but
you brought him here
I'm a
instead.
bit too worried now.
Okay.
Yeah.
Anything in Jimmy's medical history? Anything I should know about?
No, nothing.
Yeah.
Nothing that.
Is he on any regular medicines? Any inhalers? Anything
No,
like that?
nothing like that, no.
Any allergies?
No.
No. And I think John, the nurse, mentioned Jimmy's born preterm. Is that right?
Yeah. That's
How many
right.
weeks gestation was he when he was born?
About
Some obs, yeah, 2 seconds.
3.
Okay. And did he have to stay on the special care baby or anything like that?
He was, yeah.
Okay. I'm just going to go have a chat to John. I hope to get some obs. How's Jimmy
Yeah.
doing there?
Okay.
He's quieting down. He was crying before. He seemed
Okay,
quite
yeah, he seems to be a little bit quiet there. John, can we get some help just in here, maybe get a monitor on for Jimmy?
Yeah, sure, yeah. Doing it now. Okay, so I'm just going to, it might unsettle him a little bit. I'm going to try and get a blood pressure, okay? All right, first of all. And we're just going to do some observations, just check his breathing, see how he's doing, okay? All right, just pop on there. Well, he's in a bit unsettled. Let's just see if we can try and find out what's going on with him, okay? Okay. Okay. See if I can try and get a blood pressure. Is it just me or was it having a bit of a pause there? Just see what it
Just
starts
seems like a
like.
bit of a pause there, I'll agree. Have we got the APLS memoir around, you know, with the observations or...
Yeah, necrophile's just there.
Yeah.
Right. Okay, so, you know, it's just... Jimmy, come on, take a little breath there. He's just, Jimmy? Jimmy, oh, there he goes. Goodness me. Has he been doing these pauses a lot?
Yeah, he has been, yeah. It's sort of lunchtime.
Yeah.
Are you alright?
You must be past yourself, eh?
I am, yeah.
Okay. Well, look, he's in the best place. We're just going to get him sorted out. Okay, let's see what those...
Why is he doing the pot? Can he not breathe?
I think he's just a bit tired, isn't he?
Yeah, he has been crying for quite a long time, so...
Okay, so I'm a bit worried about some of these observations here. Could we get some oxygen on for Jimmy, do you think?
Absolutely, yeah.
An appropriately sized face
Non-rebreathe mask?
Non-rebreathe would be fantastic.
Yeah.
And then once we've got that on, I think I need to get back in touch with the paediatrics team.
Okay. Do you want to explain a little bit to mums? I know Mum.
So we're a bit worried about Jimmy's breathing. He's having his oxygen levels a little bit low and he's having these pauses, which can sometimes be a sign that he's tiring. We're going to give him a bit of oxygen to see if that helps, but it might mean that we need to give him some antibiotics and some other treatment as well. It's probably important that we get this oxygen on and then we'll get the paediatric doctors or some of the other A&E doctors back
Is he
in.
going to be alright?
He should be okay. We need to see how he goes over the next few
Jimmy.
minutes, really.
Right. You can see he's always fogging the mask up there. Alright, okay. Right, Jimmy. Alright, okay, that's in the
Once we've got that on, John, is there any other A&E doctors that would be able to come and help? Any A&E regs or paediatric regs?
Bright, can you see if there's any more of the A&E docs up there, Bright? Yeah, we're just gonna. He's not well. We just need a bit more help. Yeah. Can you just tell him as soon as I finish there? Can they come down, please? Yeah. Right. Okay. So.
Okay.
Is there someone else coming, or...?
We're asking some of the other doctors just to come and give us a hand because sometimes when we've got poor little babies, it's useful to have some extra people on board.
just in case.
Just in case we need that, yeah. And then we should probably get some emergency drugs out as well.
Okay.
So we said Jimmy's 7 months old.
Should we give the anaesthetic nurse in?
Yeah, we should get an airway team down here would be very useful actually. And I can see there's some drugs out here as well.
Hi, it's John and Peds Resource. Need anaesthetic nurse down here. Pronto, please.
Do you know how much Jimmy weighs recently? Have you weighed at all?
Urgently, yeah.
Okay. So he'd be
I've just got
7 months old.
to
Okay, thank you.
We're just down here. Down here, yeah, thank you. Right, okay. Right, sorry, drugs, yes. Did you have anything in mind?
I think probably a ketamine-based RSI.
Okay.
So if we think that he's 7 months old, we can call that half, so 4.5. He's probably of the order of about 10 kilos.
Right.
Hello. Hi,
I'm
Dean.
Dean from theatres.
Oh, lovely. Just hand me down anaesthetic reg. We've got Jimmy here, 7 months old, who's quite poorly.
Hello, I'm Dean, part of the anaesthetic team.
Respiratory distress, having some apneas.
Okay.
We're worried that he's tiring, that he might need intubating.
Right,
We
okay.
probably need to get on the phone to Nectar as well, but I'm really sick child here as well. So I'm just going to go and make that phone call.
Okay, do you want me to start setting up some
You can start
things,
getting
yeah?
up some drugs. We think its estimated weight's about 10 kilos.
That's okay,
So probably a ketamine RSI if we can get some drugs.
Mentioned ketamine.
A wet flag done
Yeah.
would be great, yeah, thank
Okay.
you.
Do you want Jimmy on the bed around here?
Yeah, if we get
at the
him, I
moment.
think on the bed would be better actually.
Yeah, is that okay?
Yeah.
Is he alright?
Hello, I'm Dean. Sorry?
Anymore.
Not crying anymore. Jimmy, let's have a little look. Jimmy? He's still fogging the mask up there. Ah, that's it. Do you think it would be okay if we could just get him onto the bed just so we can assess him and get the clothing off and things like that as well? Is that alright if I help you just get him onto the bed there? So if you just want to bring him over.
Hello, simulation switchboard.
Hiya, can I get through to the paediatric consultant on call, please?
Paediatric on call.
Thanks.
Is he alright there? You seem quite comfortable with mum there.
Okay, thanks, Dean.
Hello, Nigel Smith, paediatric consultant.
Hi, it's just Andy, the anaesthetic reg down in A&E. I
Hi.
spoke to you earlier about Jimmy.
You must have spoke to my colleague.
Okay,
Yeah, go on. Sorry.
so we've got a 7-month-old child here who's come in respiratory distress, having some apneas.
Oh, you mentioned, yeah.
Yeah, so he's quite poorly. I think he's going to need intubating because his apnea is becoming a bit more prominent now. He was saturating 90% on room air, so we've put him on some oxygen. We're hoping getting some IV access, and we're setting up some drugs for an RSI.
Okay.
I think this child probably then will need transfer out. I don't know whether you'd like us to arrange that or you want me to speak to Nectar to get some further advice.
My colleague's busy, it's why I've come in.
Okay.
Yeah, I can come down, and then if you're dealing with the intubation, I'll
Yeah.
be very happy to speak to Nectar.
Okay, great. That'd be perfect. If you come along, that'd be fantastic.
So you think the child's definitely tiring and needs intubation?
Yes.
You feel like that?
That's my assessment at the moment, but I'd appreciate your input as well.
Okay. I mean, sometimes we use the nasal, the high flow nasal cannula. And do you think
Yeah.
that might help, or is that not going
It
to
might.
do here?
I think it's worth a go for sure. Yeah, because obviously if that works, then it would avoid a high risk intervention. So
Okay. Right.
I can ask
all right,
Steve to see if we've got high flow nasal.
Yeah, things have settled a little bit here, but my colleague's still very tied up, so I'll come down.
Okay. Lovely. Thanks.
Thank you.
Right, 4 joules per kilogram, 4 joules.
Okay, so we're just working on wet flag. Yeah, what's the
Sorry to
plan?
interrupt there. So I've spoken to the PEDS consultant, Dean. He's wondering if we can temporise things with high flow nasal oxygen.
Okay.
And if we're able to set that up for a 7-month-old.
Okay, high flow nasal. Right, I'll just go on there.
In terms of your plan for if we do go for intubations, what size
Brian,
of things would you like?
Can you get the high flow nasal, and will you get another?
Size straight blade, 4.5 tube, a size up, a size below.
High flow, yeah.
If we've got a straight blade, we need suction. It would be an RSI.
Got suction. Right. Right. I think they'll
I
need
think that would be
to.
the main thing.
The high flow, the Peds ward's got that, they will get that.
There's Peds ward, is it?
Yeah, it's a Peds
Great.
ward, they'll have
Right.
it there.
Okay.
And you've got your drugs.
No, it's the one.
Lovely. We've got some pressure on that. Fantastic.
Yeah, we'll have.
Thank
Yeah.
you.
Is he doing alright there?
I think he's doing okay. It's
Yeah.
stupid.
Okay, so just to talk through what's happening, so
Yeah.
we've got a 7-month-old child who's coming in respiratory distress, having some apneas, hypoxic, but we're treating with a little bit of oxygen through a non-rebreathe mask
Yeah.
there. He's looking a little bit more settled there. Has he had any more of these apneic pause? Have you noticed monthly stop breathing recently?
He did a little bit, but he's not doing it so much now.
Okay, let's have another one.
Paediatrics are on their way. They've asked us to get some high flow nasal oxygen, which we're hopefully getting. And then it's a discussion about whether we continue treatment here or whether we get neck test come
Okay.
help stabilise this child.
Just going to measure him up front anyway, just in case something.
Yes,
Do you want me to
yeah,
just mention up to maybe about
Yes, yeah, I think
just
it would be good.
We're just going to
Yeah,
stop
yeah.
there.